Understanding the differences between Colles and Smith fractures is crucial for proper diagnosis and treatment. Here, we visually compare the two, highlighting their distinct characteristics. A Colles fracture involves the distal metaphysis of the radius with dorsal angulation, often resulting in a silver fork deformity. It's more common in older adults and those with osteoporosis. While many Colles fractures are stable, it's important to check for instability signs such as intra-articular extension, radial shortening, and loss of radial inclination. This X-ray image illustrates a Colles fracture, showing the characteristic dorsal displacement and angulation of the fracture. The AP view provides additional insights, such as extension into the radiocarpal joint and ulnar styloid fracture, which are crucial for a comprehensive radiology report. A closer look at the X-ray reveals the fracture's impact on the distal radius, emphasizing the need for detailed examination and reporting. Smith's fractures typically occur in younger patients due to high-energy trauma on a volar flexed wrist, often involving volar comminution and intra-articular extension. The mechanism of a Colles fracture involves force on the volar aspect of the wrist, leading to a dinner fork deformity due to dorsal angulation. This image shows the classic dinner fork deformity associated with a Colles fracture, highlighting the dorsal displacement of the wrist. The dinner fork deformity is a hallmark of Colles fractures, visually representing the dorsal angulation and displacement of the fracture. An X-ray provides a clear view of a Colles fracture, showing the outward displacement typical of this injury. Smith fractures result from an impact on a flexed wrist, causing a garden spade deformity due to volar displacement of the distal fragment. The garden spade deformity is characteristic of Smith fractures, with the volar displacement creating a distinct wrist contour. This X-ray highlights a Smith fracture, showing the inward displacement and volar angulation of the distal radius. Smith fractures involve an extra-articular transverse fracture with volar angulation, often accompanied by an avulsion fracture of the ulnar styloid process. The mechanisms of Colles and Smith fractures differ significantly. Colles fractures result from falls on an outstretched hand, while Smith fractures occur from falls on a flexed hand. This visual comparison highlights the directional differences between Colles and Smith's fractures, with Colles being outward and Smith's inward.